Let us study about Sandhigata Vata, that is osteoarthritis. Sandhigata Vata is commonest among the elderly and obese person, result in wear and tear of the joint. So it means a condition in which morbid Vata is located in the joints and destroy the joints mobility. So Sandhi here we can consider about the Janu Sandhi, Kati Sandhi, Manipura Sandhi, and Gulfa, etc. And Gata here is the Gamana. Gamana means the one which carries something along with. So here Vayu is mainly the biological force which can recognize and stimulate the all activities in the body. As we all know, the Nidhana for the all Vata Vedis is mainly Vatakara Ahara Vihara, and we have studied it in detail about the Nidhana. But the main Nidhana for the Sandhigata Vata is mainly Dhatu Kshaya Janya and Medo Avarana Janya. So here we can consider here as Dhatu Kshaya Janya. As the patient gets older and older, the dhatu becomes kshaya. The uttara dhatu portion is going to be hampered, and all the dhatu attains its kshaya avastha, and it will leads to the manifestation of the disease called as sandhigata vata. And in case of medo avarna janya, patient with obesity due to excessive pressure over the weight bearing joint, that will leads to the production of the disease sandhigata vata in obese person. Dhatu kshayajanya sandhivata here, the main causative factor is mainly the in case of age old person, the person is getting the uttarottara dhatu portion is obstructed here. So that's why the dhatu kshaya is present. That dhatu kshaya will leads to the prakop of vata. This prakopita vata spreads all over the body or circulates all over the body through the statosis, and it does the shoshana of Shoshana or Kshaya of this Lakshmaka Kapha as well as Asti Dhatu. And it does Kavagunata in the Sandhi, and the Prakupita Vata would get resided or Sthana Samshrita in the Sandhi, and further leads to the manifestation of these symptoms. So, Medo Avarana Janya Sandhigata Vata. Here, the main causative factor for the manifestation of this is mainly the Medoruddhi. So, it is mainly seen as in obese person, the obesity or the excessive ruddhi of the Meda, it does avarna to the portion of the uttarottara dhatus. So, the person with obesity here, he is getting the portion up to the level of the is getting portion up to the level of the Medo dhatu only. And after that, the Medu Dhatu does the Avana to the Poshaka Dhatu. So, the Poshaka Rasa Niyukta to the Asti Dhatu. So, for that reason, Asti Dhatu, Majja Dhatu as well as Shukra Dhatu Kshaya is seen. That further leads to the Prakop of the Vata. So, and another one cause for this is mainly pressure on the weight bearing joints. So, due to excessive body weight, the pressure is going to be on the weight bearing joints and will leads to Vanavata Prakopa in the sun. So let's see the Lakshanas. Vatapurna Trutasparshaha Shotaha Sandhigate Anile Prasarana Akunchanayoho Pravrittischa Savedana Ityuktam Sthanabhedena Vayor Lakshanamevacha. Lakshana of Sandhigata Vata Vatapurna Tritispashaha Shotaha Sandhigate Anile Prasarana Akunchanayoho Pravrittischa Savedanaha Ityuktam Sthanabhedena Vayor Lakshanamevacha. So the Lakshana are mainly Vatapurna Triti Sparshaha. Here, the sound resembles that made when rubbed against a balloon or a transparent container is filled with the balloon. On palpitation, at the affected joints, it will resembles the sound like that of when we rub our hand against a balloon or a transparent container which is filled with a balloon, we can consider. Okay, next is shotaha. Shota he means here is the swelling. Sandhigate anile. So the vata prakopa takes place in that reason and it will leads to the production of pain. Prasarana akunchana yoho pravrutischa savedanaha. At the time of extension and flexion, the patient feels the pain. Chikitsa of Sannivata, Snehopanaha Agnikarmam, Bandon Mardananica, Snayu Sandhi Asti Samprapto Kuryat Vayavat Indratah. So he explains about the Snehana, Upanaha, Agnikarma, Bandhana or Unmardhana, and he explains all the measures which are useful for subsiding the vata, and also it will be helpful for the uh, snayu, sandhi, and asti. So, according to Ashtanga, Sravasandhi Shiroprapte Sneha Tupanahanam Tailam Sankuchitam Mabhengo Saindava Sadhitam. So, here he explains that the use of a Snehana Karma and Upanaha also, the Taila, the Abhenga is done by using the Taila, which is processed with the Saindava, Lavana. So, this is according to Chakradatta, that is a Sneha Upanaha Agni Karmam बंधोन उन्मर्दनानि च स्नायु संधि अस्ति संप्रायो कुर्यात् वात विचक्षणे. The same as that of the Shushrutas, he explained it in different words only. Let's see about the chikitsa of this. So, in case of chikitsa of this Sandhigata Vata, first and foremost, we have to follow the Purva Karma, Pradhana Karma, and Pancha Karma procedures and all. And also, Bahir Parimarjana Chikitsa and Anta Parimarjana Chikitsa is also followed. First of all, in case of Bahir Parimarjana Chikitsa, we are going to have that the Snehana and Svedana. Here, in case of Snehana, we are going to use different types of tailas which are helpful for the pacifying of the Vata and Kapha, because here the main involvement is both vata and kapha is involved, and also one of the reason is the dhatu kshaya is also one of the reason for that. So let's see what are the main taila or the snehas which is used in here as a bahir parimarjana chikitsa. So in case of vataja, we are going to use mahanarayana taila, nirgundi taila, karpura taila. In case of vata kapha, we are using vishagarbha taila, saindava taila, dashamuladi taila, and kotamuchakadi taila. In case of degeneration with atrophy, we are advising the patient to for the abhenga is given for the patient with the ashwagandha bala taila, lakshadi taila, dhanvantara taila, bala taila, mahamasha taila, and shirabala taila. Swedana. So Swedana, in case of if vata is involved, vata is only involved, we are taking nadi sweda is given by using the vata which are vatahara, like the shumula is used here. So mainly we are using the nadi sweda, nirgundi patra pinda sweda, and shastika shali sweda is given in case of vata predominant. In case of vata is predominant along with the kapha, then we are going to advise the patient with the ruksha sweda by using kola kulatyadi choda, and also baluka sweda can be given as a rukshartha. Third one is the upanaha. For upanahartha, we are using the erandat patra or nirgundi patra, arka patra, in case of if only there is an involvement of vata. If there is involvement of vata and kapha also, then you have to use the gruhadumari churna. Okay. Next is anta parimarjana chikitsa. In case of anta parimarjana chikitsa, by giving snehapana, which is vatahara, as well as which if depending upon the condition of the patient, and depending upon the doshic predominance, you have to advise the abhyantara snehapana. Afterwards, we are going to give the abhyantara snehapana, and also we are going to give the svedana. Afterwards, we are advising the patient for the virechanartha. So the drugs which are used in case of virechana, in case of mrudu shodhana, in that context it says about the mrudu virechana. So mrudu virechana is done by using tilvaka gruta or satala gruta, because this tilvaka gruta acts as a vata shamaka and tilvaka acts as a virechanartha. So for that reason, we are using tilvaka and satala gruta is used. And in case of panchakarma, so before only we have done the snehana and svedana internally, you have to do the snehana and svedana for the person, followed by mrudu virechana. And virechana artha dravyas are same only, tilvaka gruta and satala gruta. And in case of basti, here basti is taken in two ways. First one is internal basti, and second one is local basti. So internally basti you are going to give what the panchatiktaka kshira basti, and mustadi yapana basti, raja yapana basti, or yoga basti can be given internally, because basti is considered as ardha chikitsa in case of all the types of vata vadis. And in case of locally, we can consider the janu, griva, and kati basti is given depending upon the manifestation of symptoms in the patient. We can give the janu, griva, and kati basti. So nasya is also given, but in not it is not preferred in all the cases. If the whole Shodhana of the Sharira is needed to be done, then in that cases we can advise the patient with the Nasya. Snigdha Sveda Nivatancha Sthanam Pravarani cha. So person is advised regularly with the Snehana followed by Svedana, and he or she should be advised to sit in a place which is devoid of breeze. And Rasaha Payamsi, Rasa here considered as a Mamsa Rasa, Payamsi regularly he or she has to take the milk. Vojanani, Swadu Amla Lavanani cha, the food which should be having or which should be enriched with the Swadu Amla and Lavanarasa. Brahmanam yetchatat sarvam prashastam vataroginam. So the food items which is given to that patient, it should be Brahmana in nature. It should be nourishing to them. So you can advise the Yusha and also a Peya, Yusha, Manda, Peya, Vilapi, and also Mamsarasa is advised to the patient depending upon their capacity to digest. So this is regarding the uh, so this is regarding the general line of treatment or general things which should be followed in all cases of vata roga. सर्पिस्थैल वसामज्ज सेक अभ्यञ्जनं वसयः स्निग्धः स्वेदा निवातं च स्थानं प्रावराणि च रसः पयांसि भोज्यानि स्वादु आम्ललवणानि च ब्रह्मणं यच्च तत्सर्वं प्रशस्तं वातरोगिणां. So in all cases of vata roga, this is the thing that should be followed by the person. First is the sarpi, taila, vasa and majja. These are the chatursneha. So they have to take it regularly. There must be a regular intake of these four food items in their diet. Next is abhenjana, that is external application. So obviously we are advising the abhenga and basti. Basti is important here. We can consider the local basti because it is responsible for the pain management. It is responsible for the management of pain. Snigdha Sveda Nivatam cha Sthanam Pravarani cha. So person is advised regularly with the Snehana followed by Svedana, and he or she should be advised to sit in a place which is devoid of breeze. And Rasaha Payamsi, Rasa here considered as a Mamsa Rasa, Payamsi regularly he or she has to take the milk. Vojanani, Swadu Amla Lavanani cha, the food which should be having or which should be enriched with the Swadu Amla and Lavanarasa. Brahmanam yetchatat sarvam prashastam vataroginam. So the food items which is given to that patient, it should be Brahmana in nature. It should be nourishing to them. So you can advise the Yusha and also a Peya, Yusha, Manda, Peya, Vilapi, and also Mamsarasa is advised to the patient depending upon their capacity to digest. So this is regarding the uh, so this is regarding the general line of treatment or general things which should be followed in all cases of vata roga. So some of the formulations which are used in case of vata vyadhi. So before going for the formulations, some of the single drugs which are most effective in the treatment of this sandhigata roga or are mainly, you can advise the shalaki, you can advise nirgundi, Gulu, Shunti, Gandaprasarani, or Kuchala can be given as a single drug if you want to treat the patient by using only single drugs. The most effective here is mainly Shalaki and Gugulu. So they can be given to the patient 2 times in a day along with lukewarm water can be given. Next, the some of the Gugulu preparations are there. Those are Mahayogaraja Gugulu, Yogaraja Gugulu, Kaishora Gugulu, and Rasna Gugulu, Simhanada Gugulu, and Lakshari Gugulu. Vata Vishvansa Rasa and Bruhat Vata Gajankusha Rasa. And Churna. Among Churna, Narsimha Churna is considered to be the best. Along with that, we can advise the Vishatinduka Churna, Ajamodadi Churna, Ashwagandha Churna, Pipali Churna, Shunti Haritiki can be given. Next, in case of Rasayana, Amrita Bhallataka Rasayana can be given or Dashamola Haritiki Rasayana can be given. Next, and also Ashwagandha Rasayana can be given. And some of the Asava and Arishtas are mainly Dashamola Arishta and Ashwagandha Arishta can be given. And the Tailas I have mentioned earlier only. And also the important one is mainly Mahanarayana Thaila and Dhanvantari Thaila. Nirgundi Thaila, Vishagarbha Thaila can also be given based on the condition of patient. So this is regarding the Sandhivata, the management of the Sandhivata.